Interactive case scenario. Case. A 7-year-old child with a history of asthma is admitted to the PICU with worsening respiratory distress despite initial bronchodilators and corticosteroids. He is agitated, refusing to keep the NIPPV mask on, and is otherwise hemodynamically stable with normal CO2 levels. Question 1. Which sedative is the best initial choice in this situation? A. Midazolam. B. Morphine. C. Ketamine. D. Propofol. Correct answer, C. Ketamine. Rationale. Ketamine provides both sedation and bronchodilation with minimal respiratory depression, ideal for a child who is not hypoxemic or hypercarbic, but needs help tolerating NIPPV. Which of the following is true regarding ketamine in the setting of acute asthma? A. It depresses respiratory drive significantly. B. It is contraindicated in NIPPV. C. It provides sedation with bronchodilation. D. It increases bronchospasm through histamine release. Correct answer, C. It provides sedation with bronchodilation. Rationale. Ketamine is a preferred agent in acute asthma due to its bronchodilatory properties and minimal respiratory depression. A 5-year-old child with asthma is admitted to the PICU. She is anxious, tachypneic, but has normal CO2 and oxygen levels. She is refusing to tolerate NIPPV. Which sedative is most appropriate to start with? A. Midazolam. B. Propofol. C. Dexmedetomidine. D. Morphine. Correct answer, C. Dexmedetomidine. Rationale. Dexmedetomidine is useful in children requiring sedation for NIPPV tolerance, without the bronchodilatory need. It does not depress respiratory drive and has fewer side effects than ketamine in this setting. Question. Which patient may benefit from sedation with dexmedetomidine? A. An anxious child without any respiratory support. B. A child requiring NIPPV but intolerant to the mask. Correct answer, B. Rationale. Dexmedetomidine helps patients tolerate NIPPV without depressing respiratory drive. It's especially useful when bronchodilation from ketamine isn't necessary. Why is fentanyl preferred over morphine in ventilated asthmatic children? A. Fentanyl causes bronchodilation. B. Morphine has a longer half-life. C. Fentanyl does not cause histamine release. D. Morphine increases respiratory drive dangerously. Correct answer, C. Fentanyl does not cause histamine release. Rationale. Morphine can trigger histamine release, worsening bronchospasm. Fentanyl is preferred for its stable profile in asthma. Case. A 9-year-old intubated child with acute severe asthma requires high PIP and is coughing against the ventilator. She's already receiving a ketamine infusion. Question 2. What additional intervention can improve ventilator synchrony and prevent barotrauma? A. Switch to morphine for analgesia. B. Add a neuromuscular blocker like vecuronium. C. Stop ketamine and use dexmedetomidine only. D. Add isoflurane via a regular ICU ventilator. Correct answer, C. Initiate continuous vecuronium with train of 4 monitoring. Rationale. Neuromuscular blockade may be needed to prevent ventilator dyssynchrony and barotrauma in severe cases. Which of the following is true about inhaled anesthetics, like isoflurane, in intubated asthmatic patients? A. They are first-line therapy for asthma requiring intubation. B. They worsen respiratory acidosis. C. They are CNS depressants and may reduce need for additional sedation. D. They can be delivered through standard ICU ventilators safely. Correct answer, C. They are CNS depressants and may reduce need for additional sedation. Rationale. Inhaled anesthetics provide bronchodilation and CNS depression, but should be reserved for refractory cases and require specialized equipment and training.